It's one thing to know about the science of wellbeing. It's one thing to understand the policy work that's happening, but how do you build wellbeing at scale? How do you do it cost effectively? How do you know that it's working? Well, these were the questions we asked ourselves, but our objective was to build South Australia as a state of wellbeing, as a prototype for the rest of the world by answering those questions. Our goal is to translate the science of psychological health, happiness and wellbeing into the population and create a cultural movement towards wellbeing, a desire for wellbeing. We are the state of wellbeing in South Australia, but always as a prototype for the rest of the world, not just with ourselves in mind. How did it happen? Well, it's no accident that's happened in Adelaide. Adelaide is a small capital city, a bit bigger than Copenhagen. 1.3 million people out of the 1.6 million in South Australia live in Adelaide. It's an ambitious, innovative capital, and in this context of livability, good health, attractiveness for tourism, etc., the Wellbeing Initiative has emerged. But how did it happen? What triggered it? And here's the beginning of my strategic story, which many of you are already involved in, driving this work forward in your places, and this is our story. Some time ago, I was running the Adelaide Thinkers in Residence program, which is an innovation program convened by the Premier of South Australia. And we involved ourselves in lots of major challenges in the 21st century, and part of our solution was to bring in global leaders who could contribute to problem solving and setting new visions to solve the complex challenges. One of the challenges that was clearly emerging in 2010 and 11 was the great projected and actual rise of mental illness in South Australia, combined with problems in productivity that Australia knew that it was experiencing, South Australia certainly knew that it was experiencing. We hypothesised that perhaps building the flourishing of our state might have an impact on reducing the number of people who fell into catastrophic mental illness and improving productivity. And to that end, we invited Professor Martin Seligman to South Australia. I'm not sure if Marty's in the audience today, but he came as the world leader in positive psychology to be our thinker in residence about addressing those two problems, improving mental health and improving productivity. Here's what Marty had to say about South Australia 3 years ago.
So what's needed is for well-being to be on the political agenda, and more importantly, to be in the warp and woof of a community, that a community is about increasing the well-being of the individuals in it. And what being in South Australia opens the question of how do you go from individual well-being, which we now know how to measure, and even something about how to build. So how do you do this for an entire community or an entire state?
That was a profound question that Martin asked our whole community. He asked the Premier, he asked the politicians, he took it to the Economic Development Board, he spoke to the psychologists, the psychiatrists and the teaching profession, and he spoke to a total of 14,000 people in our state. He was a stimulator of discussion about this issue, and he brought with him the message that wellbeing is learnable, teachable and measurable. And with that message arose a real feeling of confidence and acceptance of the idea that wellbeing could have a lot of value for our state. And the why of wellbeing suddenly became apparent to everyone, and it wasn't the same why for everyone. Some people really wanted more well-being for themselves and their families or their society. Some people aspired to happiness and believed that's what everybody wanted for their children. Many other people found the challenges of the 21st century very difficult to handle and felt that resilience was something that was needed. And of course, the whole state knew that it needed to address productivity, and everybody agreed that we needed to reduce mental illness. So suddenly, instead of having one note and one desire, build well-being or build happiness, we had a chord of motivation that struck all of the different players in our society behind this striving to become the state of well-being. And we took an approach of me, we and us, which our head of research, Dr. Aaron Jardin, often refers to, because this is not just about individual well-being, it's about the well-being of the whole society. And I note that when UAE writes in its magnificent policy manual about happiness, it refers to not just the happiness of individuals, but authentic happiness of the whole society. So we agree on that question. So what did we do first? And now my story is going to become very pragmatic. Firstly, we had to decide which measurement we should use, and we know that there are many measurements. We, after extensive consideration and discussing with a number of global leaders, decided that PERMA Plus was the measurement that we would use in South Australia. Of course, Dr. Seligman's dashboard of wellbeing is well respected. If you build the positive emotion, engagement, relationships, meaning and accomplishment of your society, you build their wellbeing. But there's a massive information, and the previous speaker spoke about it as well, the mind-body connection. It's certainly true that physical health has impacts on mental health. And we took a real interest in resilience, and so we knew that we had to measure optimism as well. So we used the words PERMA plus, and in the notion of PERMA plus, yes, it's a good measurement, but it's a measurement that can be adapted to different cohorts. And if you're aiming to build a state of wellbeing, you are talking to everybody across the life course, old and young and everyone in between. So the notion of adapting a measure and an approach across the population was very important. But what I really loved about the PERMA plus construct is that I think of each of those constructs as a big door. And behind that door, there is hundreds of years of science. There's the science of psychology and positive psychology. There's the emerging science and growing science of neuroscience and behavioural change. There's the science of sociology and relationships. There is a vast body of knowledge that we make it our job to channel and synthesise and bring up to the attention of the population, because as some people said earlier in the day, it's really necessary to push things up to people's attention so that they can focus on it. And we want well-being and happiness and resilience and psychological health to be front of mind for people in South Australia as something they want. So we also have done a huge amount of work in education, and David Engelhardt is here today from the Department of Education and Child Development. And during that period with Martin Seligman, we did a lot of thinking in South Australia about the importance of wellbeing measurement in schools. And now South Australia measures nearly 93% of its students. So we know what the wellbeing of our students is, and that's been going on for 3 years, over 1,000 schools and 250,000 young people. So all the principals of all the public schools have that data about the wellbeing of their students in order to determine their policies. And of course, we have St Peter's College in South Australia, which has offered global leadership in education about wellbeing and contributes enormously to this state of wellbeing agenda in South Australia in education. And I must say that Geelong Grammar has also been over in South Australia. So we've been richly developing both measurement and approaches to education. So once you've done your measurement, what else do you do? Then you begin your intervention. Then you measure and build, as Martin said to us. When we think about building wellbeing, we think about learning and doing wellbeing, not just building it, not just learning about it. So we looked around the world for what was the best evidence that existed 3 years ago that we could find about building wellbeing at scale. Lots of people were doing great things, but the research was quite patchy. In the end, we made a connection with Brigadier General Dr. Rhonda Cornum, who ran the Comprehensive Soldier Fitness Program in the United States with a lot of support from the University of Pennsylvania. That was one of the largest resilience training programs that we could find, and we were impressed with the evidence base about building wellbeing at scale. And because scale was our big objective, we thought we had quite a lot to learn from that big project, which was directed towards 1.3 million people, same population as South Australia. So we have Brigadier General Cornum is no longer in the US Army. She works for a company called TechWorks, and she's the Chief Medical Officer. And they have derived a wellbeing resilience offering from that previous work. It's emerged out of it, and it's within that company, TechWorks. We've licensed that product for Australasia, and we are teaching these 10 resilience skills pretty much as a kind of a positive psychology wellbeing stroke 101. Many of the introductory courses to wellbeing, resilience, building psychological health, many of them cover the same areas: mindfulness, cognitive behavioural theory, acceptance commitment work, etc., character strengths, values and goals, and this is no exception. We've trained 4,000 people with this course, and it's been received very well by young and old. Earlier in the day, we heard about the importance of simplifying. What we love about this work is it's the no-frills approach to positive psychology and the science of positive psychology, and that's been received very well by people in South Australia. So we offer that as a face-to-face course. When we use the train-the-trainer approach, which of course is another strategy for scale, we have 14 to 20 people working with us now, but we can't reach everybody. So we have to think about both online and train-the-trainer approaches. When we're training people in our train-the-trainer approach, we actually train them for longer than the TechWorks people do. We train them for 8 days. Or if we're delivering direct delivery to a health department, an aged care institution, or something like that, we give it in a 2-day program. And the program's been received incredibly well. We're currently funding and developing our technology platform, and within about 4 months, we'll have a very large technology platform which has a learning management system in it and which can handle millions and millions of data pieces into the future. But the real issue is, what's the difference between a program and a systems approach to long-term change? There have been many, many courses that offer resilience training or wellbeing training, but it's been very difficult to get it to stick. So we've thought deeply about a systems approach, and we've named our systems approach LIMBER: lead, initiate, measure, build, embed, research. Now, Martin talks about measuring and building as being the active ingredients that have to stick together. Don't just measure, build as well. But we've added these other elements to it because if you want sustained change in organisations, you must go for top-down and bottom-up. The evidence is quite clear about that if you want large-term sustainable change. You must find champions, and I can tell you it's easy to pick the champions. They're the people who've got bright sparks in their eyes whenever they begin to think about this material. It's also critical to, as I said, get the leaders involved in it right early on before the project begins. And when you initiate the project, you need to be thinking about the embedding phase. So don't just start with the easy bits. The easy bits is measurement. The next easy bit's running a course. You can find how to do that in a book. What is not the easy bit is initiating the force, the accuracy to get long-term sustainable change. And we have found that the LIMBER approach works very well. The other important issue for us when we think about scale, and we're always thinking about scale and evidence-based and research, is how do we get to the people? So we think about our society, the whole of our society, in 360 degrees, and we think about the vectors. Who are the people who have trusted relationships with the people? Who has trusted relationships with older people? Who has the relationships with the children? Who relates to the mothers? Who relates to the general group in society who are in working situation? It's the organisations in which they work. And so we take that vector approach as a mechanism for reaching scale, and that means we collaborate and create partnerships. It also means that we don't begin a 3-year research project without knowing a lot about the area that we're working in, and we co-design what we do with people. So I could talk to you at length about what's happening in schools there. I could spend the next 10 minutes on that. I won't. But suffice it to say, there are a great many leaders in South Australia driving a huge commitment to positive education in South Australia, and that is now, I believe, unstoppable, both in the public sector and the private sector. I could talk to you about our older population. We've been working deliberately for 3 years on building the wellbeing of older South Australians, and we find people up to 104 open and ready to hear about basic concepts of positive psychology and well-being. They are excited about it. There is no barrier to communicating about these ideas to people who've never heard about them before, and I can say that with complete confidence. But what we have found is critical is the embedding conversation. So we have a 6-week training course for older people using the train-the-trainer method in a relationship with 8 local governments. So the local government is our vector. But the most important thing is not the transmission of the knowledge. That's easy. You get good trainers, you get them committed to the science, you manage the quality and integrity, you choose the training well, as we have done, but then you have a conversation with people about, now that you've heard about these ideas that resonate with you, what are you going to do about it? What do you want to do about it with your life? And so at the end of the day, in the beginning of the day, it does come down to people drive their own mind. They drive their own life. And you can give them the concepts, but to encourage them in the process of embedding it in their life is the critical issue. I really do, though, today want to talk to you about the project we're doing in the prisons. This is a project across the whole of South Australia. There are 8 prisons, there are 2,000 people in the workforce, and there's 6,000 prisoners. And this is a project to build the wellbeing across the whole prison system, running for 3 years. I'd now like to introduce you to the Chief Executive of the Prison Department to hear what his hopes were when he began this project with us a year ago.
I hope the staff will have better self-awareness of their own wellbeing and resilience. I hope that it will also bring a positive impact in their family life and understanding the wellbeing and resilience of their own family and friends in the community. And ultimately, if they have stronger wellbeing and resilience within themselves and in their home, then they'll bring that wellbeing and resilience to their everyday work, which will result in a safer and a healthier correctional environment.
So this is a modern chief executive of an organisation. He could be running any organisation. The principle remains the same. He believes and hopes that by building the wellbeing of individuals, that will improve people's family and relational life, and that will then improve their ability to have wellness and health in the workforce, and inevitably improve productivity. But that is not where he's starting. He also has another big goal. He's been told by the government of South Australia that he must reduce recidivism by 20% by 2020. And he believes, it's his hypothesis, that building wellbeing in the whole population of his organisation may get there. And by 2022, we will know that for prison systems worldwide. And so far, we're tracking well. Let me give you some examples. So firstly, we used our process. We did a baseline measurement of PermaPlus. We produced individual reports for people when they did their measurement. The organisation received de-identified reports about the wellbeing of all the people in the organisation. We used the Limber approach. We had the chief executive sending out video messages about his commitment to wellbeing into the future. So we had that happen. We had the embedding strategy in place. We had our champions working. We chose our trainers well. And in fact, we've learned a lot about how to choose really good trainers over the last 2 years with this particular group. And we taught the 10 resilience skills, and we're now remeasuring. And let me show you what's happening. So our correction services in the purple dark blue line, and they started with lower wellbeing than the South Australian norm, which was in the grey line, the grey bar. You can see the South Australian norms for wellbeing are higher than the global norms for wellbeing, which you'd expect because it's a relatively wealthy, relatively peaceful society. But between measurement 1 and measurement 2, in the whole organisation, across the prison system, the wellbeing of the staff improved. Now, this is interesting. Not everybody had received the training. What that tells us is that the communications from the boss, the plan for embedding, the beginning to build the culture of wellbeing is having a contagious effect on the whole organisation, even before everyone's been trained in the skills. So then what did we find? Well, we did find, and so we should have, that those who received the training had bigger improvements in wellbeing than those who had not, which of course we expected and confidently expected to occur. But look at this. This is the most interesting thing. Against a control group, which is the middle blue line, those with the highest wellbeing after training improved their wellbeing somewhat. But those with the lowest wellbeing, which is the green line, improved their wellbeing significantly. This is a really important piece of data. This suggests that those with the lowest wellbeing improve their wellbeing more when they receive a wellbeing intervention. Now, those with the lowest wellbeing are also the people who may be likely to experience mental illness. They may be likely to be absent more often and experience psychosocial stresses, so they are more expensive and more vulnerable than others. So to know that a simple 10-skill basic intervention to build psychological health can have that impact is really good news, and we're very excited about it. The company, the prisons organisation, has now just told us some other news, which is a 12% reduction in sick leave over this year, and they can't think of any other reason for it but in particular a 22% reduction in sick leave among the frontline staff. So those at most risk, those experiencing the most stress in a very stressful job, show significant improvement in sick leave, and there's a 29% reduction in significant psychological injury claims. So the cost of doing this work can be covered by reduced costs of running a healthy organisation. So there is no barrier to doing a 3-year project which measures and builds wellbeing and wrap research around it and contribute to the global research base on how to build wellbeing at scale. That's really good news, I think. I now have to move quickly because my time's just about running out, and I'm going to do so and then stop earlier. Simply to say that in an automotive industry, we found the same thing. Massive decreases in costs of running the business and improvements in wellbeing and improvements in productivity, which is where we started. So we're building the state of wellbeing in South Australia. Do it with us. The state of wellbeing can go to any scale. It can be a municipality, it can be a state, it can be a country. Let's do it together and let's pool our research efforts so we can learn rapidly about building wellbeing at scale, not slowly. The science is there, it's the implementation side we have to work out together. What sets us apart is an interdisciplinary approach, a sound methodology, a population health approach, and the other issues that I raised before. And I would just like to finish with a reference to some of the people who matter most when you're trying to build wellbeing at scale, which is the people of South Australia.
Right from the beginning, I did the gratitude journal. I still do it, but not maybe every day. But certainly think about it, you know, what's positive and so on. So, but right away, within a week of 10 days, I was feeling that I was more positive even so than I'd ever been before, and just looking to appreciate life.
I find that I treat my friends a lot better and I pay it forward a lot. I use the power of yet. I have a lot of perma. I use mindfulness and I harness my character strengths.
And normally I would just freak out and do something else before positive education came along, and now I'm learning to just calm my anger and not take it out on my sisters when I get home.
The most important thing is it is something you can learn. It's not, you don't have to be born a certain way. You can actually, you know, learn those skills. Doesn't matter where you're educated, what your education level is. So at any level you can learn those skills and they will, you know, help you in life.
So anyone can learn these skills in the state of wellbeing. Anyone can be in a state of wellbeing. It just remains for us to bridge from the great science that's happening into the community, and we can do that together. Thank you very much, everybody, for your attention.